Hello, my name is Ingrid. I'm from Group 3 and I'm start the day 5 of July. I arrived at 7:30 at the ambulance center and I went to room 10 to inform my arrival. Then I was instructed to go to the changing the room to change my clothes. Then I was waiting until my paramedics arrived in suitcase number 30. I even been watching how they packed and stocked the suitcase with the daily necessities. At around 8:40 a.m., we left for the ambulance center so that the paramedics who were with me could change their clothes. I was asked to wait inside the ambulance while they change. Then, when they come back, we had the first occurrence that was directed directly to table with the patient's basic informations. For example, name, age, full address, and information's personal. First occurrence, we arrived at the place around 9:45 a.m. When we entered the house, we went directly to the patient room. Immediately, the paramedic asked for her documents to fill in the form. While two others paramedics asked the patient some questions such as what medication was she taking, if she had any disease, if she had already taken any remedy today. After the question, he started measuring the patient's blood pressure, which was normal. Then he measured her oxygenation, which was also normal at 99. The patient had a lot of complaints of the chest pain and difficulty in breathing. She was very nervous and agitated, crying a lot because of the family events. So the paramedic started putting on gloves and disinfection the equipment with alcohol to perform the electrocardiogram. Also apply alcohol to the patient's chest area to place the device. After ECG result that come out immediately on the tablet, signs of arrhythmia were found. The paramedic was trying to calm down the patient who was crying a lot and need to calm down. Paramedic asked her if she had been to the doctor before, and she replies yes, but the treatments did not work. A tablet of Visiotins was the administration already. After taking the medication, the patient seemed to be calmer, so she was instructed to follow the treatment that the doctor had recommended. So I lived where we were heading towards the center, and we received another occurrence again related to the tablet. We went quickly to patient's house. The second occurrence received patient had 25 years old female, 39 weeks pregnant. We arrived at the apartment and again immediately the paramedics measured her documents and prenatal cards to know the follow-up during the pregnancy. The pregnant woman was sweating a lot and with signs of a lot of pain. While on the paramedic was collecting data and others took the pregnant woman's blood pressure, which was a little low, then took her temperature, which was 36.7. It's normal. After this procedure, the paramedic started the quick test of COVID, with gloves. She opened the swab and collected the sample from the mucosa of the mouth, then placed it in the test device. After 10 minutes, the result was negative and everything was discarded. After the produce, the paramedic asked the husband to take out the thing from the pregnancy woman and the baby, and that they went in his car behind the ambulance. We went down to prepare the ambulance for the pregnancy woman who came down walking. When she entered the ambulance, the pregnancy woman lay down on the stretch, and we went directly to the hospital. On the way to the hospital, the patient had a lot of contraction pain, more or less every 10 minutes. So we arrived at the hospital after some time, and the pregnant woman went downstairs again walking with the paramedic and her husband, who arrived right behind. I was asked to wait in the ambulance. That's all. The third occurrence, we took the patient, a 64 years old woman who was beginning treatment at the BSMP hospital, to take her to another hospital. The lady has a lot of pain in right and left and middle of the abdomen. Also complains that she feels weak. Hospital instruct the patient to go to the ambulance to be taken to another hospital. The patient have diabetes, and she talked to the first ambulance that looked for at home, but could not conclude for her had a broken apparatus. We took the patient to another hospital, but when she arrived at the hospital, there was no doctor she needed. So it was necessary to take her to another hospital. After this occurrence, we were on our way to the center and we received another occurrence. The fourth occurrence, we arrived at the place and there was a 74 years old of the woman. And a man would have recused this lady who didn't feel well and fell on the street while she was walking. He quickly rescued her and took her side the street near the place. At the scan, the lady seemed very scared and had difficulty speaking, and the paramedics immediately asked for her documents, checked her blood pressure, and also her glucose. The paramedic also examined her face and did a test for the patient to follow the pain with her age. It's normal, and the patient refused to go to the hospital but agreed to go to the ambulance to perform ECG. The ECG was performed, and soon after, they placed a venous access and convinced the patient to go to the hospital. We took it directly to BSMP to better analysis like a tomography. This is all for my day, my first day into the ambulance. Thank you.